Hello everyone. The topic for this session is Hypophysis cerebri. The objectives are to learn about the hypophysis cerebri or the pituitary gland, its situation, measurements, presenting parts, relations, blood supply, nerve supply, histology, development and applied aspects. The pituitary gland or the hypophysis cerebri is a small endocrine gland situated in relation to the base of the brain. It is also known as the master endocrine gland because the hormones released by this gland controls the secretion of other endocrine glands. It is situated in the hypophyseal fossa, also known as pituitary fossa or sella turcica. It is roofed by diaphragma celli and attached above to the floor of the third ventricle. It is oval in shape and measures anteroposteriorly 8 mm and transversely 12 mm. It weighs about 500 mg and it is related superiorly to the diaphragma celli, optic chiasma, tuber cinereum, infundibular recess of the third ventricle, and inferiorly it is related to irregular venous channels between the two layers of dura mater lining the floor of the hypophyseal fossa. Then hypophyseal fossa and sphenoidal air sinuses. On each side, it is related to the cavernous sinus and its contents. It's having two parts, adenohypophysis and neurohypophysis. So both are differ in their embryological, morphological and functional aspects. The adenohypophysis is having three different parts. Those are the pars anterior or pars distalis, also known as the pars glandularis. This is the largest part of the gland. The pars intermedia or intermediate lobe, this is in the form of a thin strip which is separated from the anterior lobe by an intraglandular cleft, which is a remnant of Rathke's pouch. Then pars tuberalis or the tuberal lobe, it's an upward extension of the anterior lobe that surrounds and forms the part of infundibulum. Neurohypophysis, it is having the pars nervosa or the posterior lobe or the neural lobe. It is smaller than the anterior lobe and lies in the posterior concavity of the larger anterior lobe. Infundibular stem contains the neural connections of the posterior lobe with the hypothalamus. Median eminence of the tuber cinereum, it is continuous with the infundibular stem. The blood supply, the arterial supply is by branches of the internal carotid artery that includes the superior hypophyseal arteries on each side and the inferior hypophyseal artery. Each inferior hypophyseal artery divides into medial and lateral branches that join with one another to form the arterial ring around the posterior lobe. So branches from this ring supply the posterior lobe and also it anastomoses with the branches from the superior hypophyseal artery. The anterior lobe is supplied by the portal vessels arising from the capillary tufts formed by superior hypophyseal arteries. So the long portal vessels drain the median eminence and the upper infundibulum and the short portal vessels drain the lower infundibulum. The venous drainage is through the short veins which will drain into the neighboring dural venous sinuses. So the hormones pass out of the gland through the venous blood and are carried to the target cells. Nerve supply, the neuronal control is through the hypothalamo-hypophyseal tract. So, in the posterior lobe or the pars posterior, there will be the enlargement of the axonal end, that is called the herring bodies. So, what is hypothalamo-hypophyseal portal system? So, it begins in the supraoptic and paraventricular nuclei of hypothalamus. Its short fibers terminate in relation to capillary tufts of the portal vessels. So, that will control the secretory activity of the anterior lobe. The long fibers of neurosecretory tract pass to the posterior lobe and terminate near the vascular sinusoids. So, the hormones are transported through this tract to the posterior lobe. So, in the posterior lobe, the hormones related are vasopressin and oxytocin. The histological feature, in the anterior lobe, there are having the two types of cells. The chromophil cells, which is having the affinity towards the stain, and the chromophobe cells. Both chromophil cells and chromophobe cells, they constitutes about 50% each. Again, in the chromophilic cells, we are having two different cells, that is acidophils and the basophils. The acidophils constitutes about 43% and it includes somatotropes that secretes the growth hormone and the mammotropes that secretes the lactogenic hormone. The basophils constitutes about 7%. It includes thyrotropes that secrete thyroid stimulating hormone. The corticotropes secretes adrenocorticotrophic hormones. The gonadotropes secretes follicle stimulating hormone, and the leucotropes, they secretes luteinizing hormone. The chromophobic cells is also constitutes about 50%. It represents the non-secretory phase of the other cell types or their precursors. In the intermediate lobe, it is made up of numerous basophil cells and chromophobe cells surrounding the masses of colloid material. It secretes the melanocyte stimulating hormone. The posterior lobe, it is having the hypothalamo-hypophyseal tract that is formed by the large number of non-myelinated fibers and the pituocytes, which are the modified neurological cells. They have many dendrites which terminate on or near the sinusoids. So, the hormones in this lobe includes vasopressin or ADH, which acts on the kidney tubules, and oxytocin that promotes the contraction of the uterine and the mammary smooth muscles. Actually, these hormones are secreted by the hypothalamus, but they are carried to the posterior lobe through the hypothalamo-hypophyseal tract. And we have seen in the chromophore, we are having acidophils and basophils. So, in this diagram, we can observe the acidophils which are eosin stained, the basophils are amatoxylin stained. In between the cells, the sinusoids present, and they are lined by endothelium filled with blood. And the cleft is present between the pars anterior and pars intermedia. The pars intermedia has colloid fill vesicles, which we can observe here, which represents the remnants of Rathke's pouch. And the pars nervosa has nerve fibers and the pituocytes. So, in this diagram we can observe the hormones released by the pituitary gland. So, those includes the adrenocorticotropic hormone that acts on the kidney or the adrenal cortex. Thyroid stimulating hormone TSH acts on thyroid and then it helps in the secretion of thyroid hormones. The gonadotrophic hormones includes the FSH and LH. Then prolactin, which acts on the mammary gland, the growth hormone, the oxytocin and antidiuretic hormone that acts on the kidney tubules. So development. So we have seen both adenohypophysis and neurohypophysis. They will be having a different embryological basis. The adenohypophysis develop as an outward growth called Rathke's pouch to form the ectodermal roof of the stomatium during third week of intrauterine life. So as the development progresses, the Rathke's pouch is cut off from the stomatium. Then the anterior wall of Rathke's pouch proliferates to form the pars anterior. The posterior wall remains thin and forms pars intermedia. So the cleft of the pouch persists as a cleft that separates the two parts. The neurohypophysis develops from an evagination of the neuroectoderm of the hypothalamus or the floor of the third ventricle. It divides the two parts, that is pars posterior and the stalk of hypophysis. So the neuroectoderm and the neurohypophysis and the adenohypophysis, they will be having a different origin, that is the neuroectodermal diverticulum from the floor of the third ventricle and the ectodermal pouch from the roof of the stomatium fuse with each other to form the hypophysis cerebri. Applied aspects. It depends on the effects of the pressure on the surrounding structures and also on the specific symptoms depending upon the cell type of the tumor. So general symptoms due to pressure includes the enlargement or the sella turcica. Then bitemporal hemianopia because of the pressure over the central part of the optic chiasma. The rise in intracranial pressure if there is a pressure upon the third ventricle, and hypothalamic syndrome if there is a pressure over the hypothalamus leads to the hypothalamic syndrome. So due to specific hormone excess or deficiency leads to the following conditions. If there is a excess hormone in anterior pituitary, so primarily they may cause the prolactinoma, acromegaly, Cushing syndrome, or rarely the TSH or LH or FSH adenomas, and secondarily they can produce the disconnection, the hyperprolactinemia. Then if there is an excess in hypothalamus and the posterior pituitary, it may lead primarily to the SIADH, that is syndrome of inappropriate antidiuretic hormone secretion. Then if the hormone deficiency in the anterior pituitary, that leads to hypopituitarism primarily. Secondarily, the growth hormone deficiency or the GnRH deficiency leads to Kallman's syndrome. If it is deficiency in posterior pituitary hypothalamus, then it leads to cranial diabetes insipidus. The hormone resistance, the growth hormone resistance or Laron dwarfism, nephrogenic diabetic insipidus. And the non-functioning tumors includes pituitary adenoma, craniopharyngioma and metastatic tumors. So acromegaly, in this diagram we can see the features of acromegaly. This kind of a person, they will have a prominent supraorbital ridges with large frontal sinuses. Then thickened skin will be there and enlargement of the feet, increased heel pad thickness, and also the enlargement of ants, arthropathy, and there will be enlargement of the liver and the enlargement of lips, nose and tongue will be there. So in these persons, the chances of colonic cancer will be 2 to 3% more compared to the normal persons, and also the cardiomyopathy or cardiovascular diseases will be more compared to the normal persons. So here in this we can see the pituitary adenoma, which is occupying in the sella turcica. So if the adenoma is enlarging, so depending upon that pressure over the surrounding structures, we have seen the effect of the pressure upon the different structures. So now the questions for assignment. Describe the situation, relation, blood supply, nerve supply and applied aspects of pituitary gland, development of pituitary gland, histological features of pituitary gland, and name the parts of pituitary, hypothalamo-hypophyseal portal system. Thank you.